Have you ever felt perfectly fine one day, only to wake up the next with a strange heaviness in your head or a moment of fog you couldn't explain? A patient of mine once told me that she thought cholesterol only mattered to her heart until the day she experienced a sudden wave of dizziness that changed her understanding forever. And I want you to imagine this with me. What if the quiet changes happening inside your blood vessels were shaping your brain's future without you noticing at all? Many seniors believe cholesterol is only a heart issue, but the truth is that cholesterol has a powerful influence on the brain. In fact, some of the most dangerous effects of high cholesterol have no obvious symptoms at all. There is no pain, no warning, nothing that tells you your arteries are getting narrower, stiffer, or more fragile. This silence is exactly why strokes can appear so suddenly and feel so unfair. Very few doctors take the time to explain how cholesterol actually leads to a stroke. Many people hear phrases like, "high cholesterol is dangerous," but they never hear why. They never hear how cholesterol buildup can slowly tighten the blood vessels that feed the brain, or how a small rise in blood pressure can suddenly overwhelm a vessel that has silently weakened over the years. Let me put it simply. When there is too much cholesterol, it sticks to the walls of your arteries like residue inside an old pipe. Over time, that buildup narrows the space for blood to flow. After the age of 60, blood becomes thicker, circulation slows, and the vessels themselves lose some of their flexibility. It takes far less pressure than you think for a vessel in the brain to get blocked or even burst. Understanding this is not meant to scare you. It is meant to empower you. When you understand your body, you become more confident, not more fearful. You learn how to protect yourself with small daily choices, and that is exactly where we are headed next. In Part 2, we will explore how cholesterol truly impacts the brain, why stroke risk rises so sharply after 60, and which common habits quietly make the problem worse without anyone realizing it. Stay with me, because what you learn next may change the way you care for your body from this moment forward. How cholesterol actually causes stroke. As we begin this deeper conversation, I want you to imagine the arteries in your brain as small, delicate highways. Every second, blood flows through them, carrying oxygen, nutrients, and energy to keep your memory, focus, and movement alive. Cholesterol itself is not the villain many people think it is. Your body needs cholesterol to build hormones, repair cells, and protect nerve fibers. The problem begins when cholesterol becomes unbalanced, especially when LDL rises above what your arteries can safely handle. Think of those arteries like the inside of a household pipe. When the pipe is brand new, water flows effortlessly. But over time, minerals begin to settle along the inner walls. What starts as a thin film eventually becomes thicker and harder. The same thing happens inside your blood vessels when LDL builds up. It sticks to the walls and forms plaque. At first, the buildup may be tiny and harmless, but as the years pass, those layers grow thicker and harder. The passageway becomes narrower, the flow becomes restricted, and the pressure on the vessel increases. Now imagine this narrowing happening silently for years. There is no pain, there is no warning. The brain does not have a way to tell you, something is clogging my oxygen supply. The plaque sits there quietly until one day a small piece breaks loose. That broken piece can travel with the bloodstream like debris in a river. When it reaches a small vessel in the brain, it can lodge there and completely block the flow of blood. That is how an ischemic stroke often happens. A sudden blockage from something that accumulated slowly over time. In other cases, the plaque stays in place but hardens the vessel wall. The artery becomes stiff, less flexible, less able to handle changes in pressure. When blood pressure rises, especially in moments of stress or early morning, that stiffened vessel becomes vulnerable. It may not rupture fully, but it can crack or become damaged enough to trigger bleeding. That leads to a hemorrhagic stroke, which can be even more devastating. I once treated a 68-year-old patient who had perfectly normal cholesterol numbers on paper. Her LDL was not high, her HDL was fine. Yet her arteries were significantly narrowed. The reason had nothing to do with dietary fat. Instead, She was dealing with chronic inflammation from years of unmanaged stress and high blood sugar. Her cholesterol was being oxidized, changing its structure and making it more dangerous to the artery walls. Her experience taught me something I never forgot. The numbers do not tell the whole story. The condition of your arteries tells the real truth. The science is simple when we look at it this way. Cholesterol itself is not a threat until it interacts with inflammation, oxidative stress, and aging vessel walls. That combination quietly sets the stage for a stroke long before symptoms appear. Why cholesterol becomes more dangerous after 60. Now, let's talk about why this problem grows more serious as we age. Our bodies do not stay the same through the decades. After 60, the arteries naturally lose some of their elasticity. They become firmer, more rigid, and less able to expand and contract smoothly. This stiffness makes it easier for plaque to crack or block the flow of blood. The liver also changes with age. It processes cholesterol more slowly, meaning LDL tends to linger in the bloodstream longer. When LDL stays too long, it becomes more vulnerable to oxidation, the chemical process that makes it much more inflammatory. Oxidized LDL is like a sticky sludge inside the arteries, rather than a smooth particle floating by. It clings to the vessel walls aggressively. We also lose water more quickly with age. Older adults often become dehydrated without realizing it because the thirst sensation weakens. When the body lacks water, the blood becomes thicker, moves more slowly, and increases the pressure inside the vessels. A dehydrated bloodstream puts more strain on arteries already weakened by age. Add to this the fact that most seniors move less frequently than they did in earlier years. Slower movement means slower circulation. When blood flows sluggishly, plaque has more time to settle. Blood clots have more opportunity to form. Even the act of sitting for long periods affects how cholesterol behaves in the bloodstream. I once had a patient who believed she lived a very healthy life. She ate well, walked daily, and kept up with her medications. But she suffered from chronic insomnia and frequent stress. One night of poor sleep may seem harmless, but for her, it triggered a cascade of inflammation. Her LDL oxidized more easily. Her vessels tightened sharply. She didn't know that one exhausting night could create the perfect conditions for a stroke. This is why stroke risk rises so sharply after 60. The body becomes less forgiving, and the consequences of small habits become more powerful. Hidden cholesterol risks. Doctors rarely explain. There are also risks most people never hear about because appointments are short and discussions are often rushed. Many seniors believe LDL is the only number that matters, but triglycerides can be equally dangerous. High triglycerides fuel inflammation, thicken the blood, and reduce the flexibility of the arteries. Another hidden danger is oxidized LDL. This is the form of cholesterol that becomes chemically damaged by stress, smoking, high sugar intake, or lack of sleep. Oxidized LDL behaves differently from ordinary LDL. It is more likely to form hardened plaque. It attracts inflammatory cells. It turns the vessel wall into a fragile, irritated surface. Sugar and refined carbohydrates also play a much bigger role than most people realize. Many seniors think cholesterol comes only from fatty foods, but sugar causes the liver to produce more cholesterol internally. Eating white bread, sweets, sodas, and processed foods can raise cholesterol faster than eating eggs or chicken. This surprises many of my patients because they thought cutting fat alone would solve their cholesterol problem. A lack of movement also contributes silently to the issue. Without regular circulation, cholesterol does not get metabolized properly. It sits in the bloodstream longer, giving it more time to oxidize or settle into the arteries. I remember a patient who was shocked when I explained this to her. She avoided fried foods and thought she was doing everything right. But she drank 3 glasses of sweet tea daily and rarely walked more than a few steps inside her home. Her cholesterol was climbing not from fat, but from sugar and inactivity. These are truths many seniors deserve to hear more clearly. Cholesterol myths that mislead seniors. There are several myths that keep seniors from understanding their real level of risk. One of the most common is the belief that if someone has had high cholesterol for years without symptoms, they are used to it and therefore safe. Strokes do not care how long your cholesterol has been elevated. The arteries do not toughen over time. They weaken. Another myth is that the absence of pain means everything is fine. Arteries do not have pain receptors like skin or muscles. They can be 90% blocked, and you could still feel normal. That lack of pain is why so many strokes seem to come out of nowhere. Some believe only overweight people struggle with cholesterol, but genetics, age, stress, and diet can raise cholesterol in anyone. I've seen thin patients with high LDL and heavy plaque buildup. I've seen heavier patients with clean arteries. Weight does not tell the full story. And then there is the belief that once someone starts medication, they can eat anything they want. Cholesterol medication does not cancel out the effects of daily habits. It supports the body, but it cannot overcome every poor choice or hidden risk. Medication lowers numbers, but lifestyle protects arteries. I've had patients who trusted only the pill and ignored their routines. They were shocked to discover that the plaque continued to build because inflammation and poor sleep were still damaging their vessel walls. Breaking these myths is an important step toward prevention. Early signs of cholesterol-related stroke risk. Let's talk about the subtle signs many seniors ignore because they assume these sensations are just old age. If your cholesterol has been affecting your arteries for years, your brain may be receiving less blood flow than it needs. This can show up as dizziness when standing up, brief episodes of blurred vision, tingling in the face or hands, or quick headaches that appear and disappear suddenly. Some describe a foggy feeling in the morning, as if the brain needs extra time to boot up. Others say they feel slightly off balance or mentally slow for a few moments. These signs often appear when the arteries are already strained. They are not random, they are not meaningless. They are clues. I tell my patients that the brain whispers long before it screams. Whispering looks like mild numbness. Whispering looks like a tiny flash of light or a shadow in your vision. Whispering feels like a momentary pause in your thoughts. If those whispers are ignored long enough, they become the first chapter of a much bigger problem: lifestyle changes that actually lower stroke risk. This is the part of the conversation that brings hope. Cholesterol levels and artery health can improve at any age. I have seen 70-year-old patients make changes that transformed their numbers within months. One of my patients, 74 years old, lowered her LDL by 40 points simply by walking 20 minutes daily and cutting out sugary drinks. She didn't join a gym, she didn't start a strict diet. She just made small, consistent choices. Reducing sugar and refined carbohydrates helps more than many people expect. Adding green vegetables, beans, nuts, and omega-3 rich foods improves vessel flexibility. Drinking enough water keeps blood flowing smoothly. Light daily movement stimulates circulation, helping cholesterol move through the bloodstream instead of settling into the arteries. Getting good sleep and managing stress are also powerful. A single night of poor sleep can raise inflammation and change how cholesterol behaves. Chronic stress spikes cortisol, which damages vessels and increases LDL oxidation. Even gentle breathing before bed can make a meaningful difference. Routine cholesterol checks every 6 months help seniors catch changes early. Understanding the numbers gives you power. Asking questions gives you control. What seniors should ask their doctor. When it comes to protecting your health, your voice is one of your strongest tools. Many seniors sit quietly during medical visits, but asking the right questions can save a life. Ask whether your LDL is oxidized. When asked whether inflammation is playing a role. Ask if your medications influence your cholesterol. Ask whether more detailed tests like calcium scoring or advanced lipid panels would be helpful. One of my patients asked me a single question that changed her entire treatment plan. She said, "Do I have inflammation?" That simple question led us to discover hidden issues in her diet and sleep patterns that were raising her cholesterol more than fat ever did. She avoided a stroke because she chose to speak up. Your health is a partnership. You deserve to understand what is happening in your body, and you deserve the truth, even when doctors are too rushed to explain it fully. As we close our time together today, I want you to take a moment and acknowledge the incredible journey your body has been on. It has carried you through decades of laughter, loss, discovery, and resilience. It has protected you in ways you may never fully see or understand, and even now, it continues doing everything it can to keep you alive and well. That alone is something worth honoring with gratitude and gentle care. Understanding cholesterol and stroke risk is not about fear. It is about clarity. It is about seeing your body with new eyes, recognizing the quiet signals it sends, and learning how to support it with simple choices each day. When you understand how your arteries work and how easily they can be overwhelmed, you begin to feel empowered instead of overwhelmed. Knowledge gives you confidence. Awareness gives you strength. Small habits begin to feel meaningful because now you see the connection between each choice and your long-term well-being. You do not need to change everything at once. You do not need perfection. A little more movement, a little less sugar, a glass of water at the right moment, a calmer night of sleep, a question asked during your next doctor's visit. These are the small steps that shape a healthier brain, a stronger heart, and a safer future. And I want you to remember something important. You are not walking this path alone. Senior Health Daily is here to guide you, encourage you, and help you make sense of the changes happening in your body. I am here with you, cheering for you, reminding you that your health is worth protecting and your future is worth fighting for. Thank you for being here today and for trusting me with your time. Keep taking care of yourself, keep listening to your body, and stay connected with Senior Health Daily so we can continue this journey together, one hopeful step at a time.